Hello, friends. How are you doing? Welcome to the YouTube channel Health Q, the place where our mission is to motivate you to look at the brighter side of the health. And as promised, I'm back again with an Ask Me video session where we will be talking live, interacting with each other, and I would be trying to answer all the questions that you have related to your health that I have made on my channel. So feel free to put down your questions in the comment section so that I can read them and ask. By the way, I would like to wish you all a very happy Holi to all the guys who are from India. Holi is a festival of colors and we celebrate with a lot of love and care. And I would like to wish you all, although I was working today, so we have not played Holi, but rest of the people, whoever have played and who are celebrating Holi, a very, very happy Holi to you guys. So let's get started with the questions. Meanwhile, if you have not typed the question, what I'll do is I'll also read on my YouTube channel any questions if people have put. Mostly these are related to, yeah, so there's hello Jaguar. So somebody's written their name Jaguar. Okay, so you have a query. Yeah, please go ahead, Jaguar. Ask me what you would like to ask. So we will be continuing this till 4:20, 4:30 till that time. So we have got half an hour for us to interact. So make sure to be speed up in putting up your questions so that I can answer them as much as possible. Yeah, so I would like to listen your questions, whatever it is, and I would like to answer them. So Jaguar, if you can please type in. Okay, Mr. Rajkumar is there. Hello, Mr. Rajkumar. How are you doing? Happy Holi to you. Okay, so बाएं के दर्द के बारे में बताएं। बाहों के दर्द, बाएं मतलब मेरे ख्याल से आप कंधों की शोल्डर्स की दर्द के बारे में बात कर रहे हो। तो मिस्टर विवेक, जो शोल्डर पेन है ये बहुत सारे रीजंस की वजह से हो सकता है। जैसे जैसे एज है, जैसे अगर आप यंगर पॉपुलेशन की बात करते हो, अगर एज ग्रुप है बिटवीन 25 टू 35 इयर्स ऑफ एज या फिर से 40 इयर्स ऑफ एज तक के, अगर ऐसे दौरान अगर बाहों का दर्द होता है, कंधों का दर्द होता है, तो ये मोस्टली इंजुरी की वजह से होता है और या फिर बर्साइटिस की वजह से होता है। ये एक ऐसी प्रॉब्लम है जिसमें जो हमारे शोल्डर के अंदर की जो गद्दी होती है, जो पानी होता है, तो ये अगर ये किसी एल्डरली को बाहों का दर्द होता है, तो ये मोस्टली 2 वजह से हो सकता है। एक है फ्रोज़न शोल्डर की अगर दिक्कत है तो, या फिर अगर आपके शोल्डर की जो मसल होती है, जो शोल्डर को सपोर्ट करती है, इसमें थोड़ा-सा भी टियर हो गया हो या ये मसल थोड़ी फट गई हो, तो भी बाहों का दर्द हो सकता है। अब इसका जो डायग्नोसिस है, ये अल्ट्रासोनोग्राफी के मदद से होता है। जी हाँ, एक्स-रे में ज़्यादा पता नहीं चलेगा। इवन फ्रोज़न शोल्डर के बारे में भी एक्स-रे में सिर्फ़ इतना पता किया जा सकता है कि जो जॉइंट की जो जगह होती है, शोल्डर के जॉइंट की, ये जगह कम हो जाती है। लेकिन जो दर्द है वो बहुत ज़्यादा अकड़न के जैसे रहता है और ये सीज़न वाइज़ चेंज होता रहेगा। मतलब ठंडियों के सीज़न में, बारिशों के सीज़न में दर्द ज़्यादा होगा, गर्मियों के सीज़न में कंपैरेटिवली दर्द कम हो जाएगा। और ओवरऑल भी हेल्थ के साथ ही साथ ये जो दर्द है, ये थोड़ा-सा शिफ्ट या चेंज हो सकता है। ट्रीटमेंट इसका यूजुअली रेस्ट होता है, साथ ही साथ एक्सरसाइज़ होता है मेंटेन करने के लिए, मोबिलिटी मेंटेन करने के लिए। हम लोग एज़ इन फिज़ियोथेरेपी मशीन्स का भी यूज़ करते हैं जिसमें अल्ट्रासाउंड, सोनोग्राफी नॉट सोनोग्राफी सॉरी अल्ट्रासाउंड, टेंस, आईएफटी ये सारी मशीन्स का यूज़ किया जाता है। और एक्सरसाइज़ तो बेसिकली मेन मोस्ट इम्पोर्टेंट है। जिन केसेस में ये फिज़ियोथेरेपी हेल्प नहीं करती, उन केसेस में स्टेरॉइड इंजेक्शन दिए जाते हैं शोल्डर में, जो ये दर्द कम करने को मदद करती है। तो आई होप आपको हेल्पफुल रहा हो ये। आगे बढ़ते हैं अगले क्वेश्चन पे। सो जैगुआर इज आस्किंग, आई हैव बेल्स palsy for past 1.5 month. On beginning, I went to doctor. He gave me electrical stimulation followed with some Isolon tablets. Now I stopped tablets, everything simply. I'm massaging my face. That's all. I feel only 20% recovery and can't smile fully and can't blink my eyes properly. What can I do? Please tell me. So if I'm not wrong, it's 1.5 months, right? So first thing, Jaguar, you have got a good amount of time. Still, you can wait for one more month, 1 or 2, 1.5 month more for the recovery. If your face is showing little contractions also in the muscles, then electrical stimulation has to be stopped, and medicines are also usually given for 15 days, not more than that. Now you have to focus more towards the exercises, and what I would suggest is, instead of just doing exercise, first focus on massaging your face. Massaging the face is very important. That improves the blood circulation to the facial area. I made a video on how to do facial massage. After that, do some facial stretching like this. So stretch all the tight muscles that you have got. Followed by that, you do the facial exercises. That will help you out in solving your problem. So I hope this answers your question. And please be patient. It takes some time. Everybody is different, so everybody has got a recovery process also different. It depends on your immunity level, your overall health and well-being. So make sure you continue doing whatever you are doing, right? Yeah, so now I'll take a question from Rajkumar. Mr. Rajkumar is asking, Bell's palsy में फिजियोथेरेपी जो शॉक बीसी लिया जाता है लेना ठीक है? डिपेंड करता है मिस्टर राजकुमार। इनिशियल डेज में जहाँ पे आपके फेस में कोई भी कॉन्ट्रैक्शंस जब अवेलेबल नहीं है, ये जो फेस की जो मसल्स है, अगर आप मूव कर रहे हो, अगर ये जो आपको जो रिंकल्स वगैरह दिख रहे हैं, अगर ये रिंकल्स नहीं आ रहे हैं फेस में ऐसे ड्यूरेशन में, करंट लेना ठीक है। अगर आपको थोड़ा-सा भी मूवमेंट पॉसिबल है आपके फेस में, तो आपको करंट की ज़रूरत नहीं है, आपको बिल्कुल एक्सरसाइज़ पे ज़्यादा फ़ोकस करना चाहिए। ओके जैगुआर, I'll tell you in English. Okay, thank you so much, ma'am. Okay, so now Naif Ju is asking, Hi doctor, I had Bell's palsy 2 months ago. Now I'm way better. I mean 99% improved, but I still feel some pain when I press on my affected side of face. So is that mean I'm not fully cured? Yes. See, Naif, the facial pain that you experience could be because of two reasons. If your trigeminal nerve is kind of affected, followed by, so there is some sort of swelling that's internally still present inside your ear, that could lead to facial pain. Or else if you're feeling pain while pressing like this, that means that your facial muscles are tight and they have not gained that amount of strength that your normal side have. So what I would suggest is, if you can do your exercises, you can continue your exercise for almost a month, followed by some stretching and hot water compress or else hot fermentation. That will help you out in reducing your pain level. I hope this answers your question. Moving to the next question. Tanisha is asking, Hi, can overstimulation be dangerous? What is synkinesis? Yes, overstimulation, it's not dangerous, but it can lead to synkinesis. So, what is synkinesis? Synkinesis, in general term, is nothing but when your nerve is regenerating. If that regeneration, during the process of regeneration, if miswiring happens at that time, it causes something called as synkinesis. So, what is synkinesis? For example, when you are trying to smile, and your eyes closes along with your smile, so this is an involuntary movement, so that is synkinesis. Whenever you are trying to chew or else bite, at that time if your eyes are getting closed, that is a synkinesis. If you are trying to close your eyes and your face is getting pulled, that is synkinesis. So yes, it's not dangerous, but at the same time synkinesis can happen if overstimulation is done. That's why stimulation has to be done for a limited period of time. I hope that answers the question. Moving to the next question. I was on वाई सुना ठीक है क्या मैम? मिस्टर राजकुमार, जो भी आपको दवाई दी है, ये डॉक्टर यूजुअली हम एज अ फिजियोथेरेपिस्ट दवाइयों के मामले में इतने अच्छे नहीं होते, क्योंकि हमारा काम होता है एक्सरसाइज प्रिस्क्राइब करना। तो आई वुड सजेस्ट कि आपको जो भी दवाई आपकी डॉक्टर ने दी है उसको आप फॉलो कीजिए। इट इज फाइन ओनली, डॉक्टर कुछ सोच के ही आपको दवाई दी होगी, प्लीज कंटिन्यू दैट। ओके। Ma'am, do you know what is the actual cause of Bell's palsy? Please let me know. So, actual cause of Bell's palsy is a viral infection that impacts the middle ear. In middle ear, if there is viral infection, there would be swelling that happens inside the middle ear area. This swelling compresses the facial nerve, leading to and temporary paralysis. Many a times, certain deficiencies can also lead to Bell's palsy because the nerve gets more prone to develop infection. Okay, so it's mostly the viral infection that leads to Bell's palsy. Tanisha is asking, how can syncytial be treated? Syncytial, first thing, the first way to treat a syncytial is to prevent syncytial. That's why exercises are very important, and exercises has to be done in a right way. Overdoing of exercises is not good. At the same time, doing exercise less is also not good. So the initial 3 months of your facial paralysis is the time where you have to be very cautious on the quality of movement that you do in your exercises. If you're doing a right technique of exercise and you are avoiding, so the second thing, if you feel that anywhere that syncytial is starting to happen, you have to stop that with the help of your hands, with the help of relaxing those muscles. So yes, with that all, the syncytial can be prevented. Once the syncytials have developed, the focus is on reducing the aggravation of the syncytial and making the face as symmetrical as possible. So that's what we can do in order to manage syncytial. Okay, so Vivek is telling happy Holi to you too, Vivek. Thank you so much. So Tanisha, I hope this answers your question. Anybody else have any other question? Please let me know. So I think I've answered almost all the questions that have been asked. And also, guys, one more request. Please stay tuned on the community tab. Make sure that you have subscribed to the channel and press the bell icon, because I would be doing this live sessions very often. The days might change depending on the days when I'm able to come online, because mostly I'm seeing patients. So I sometimes I'm not just able to come online. So every week I would be doing one live video session. Remember this, but I would be letting you know when this is happening a day prior to it. So make sure to stay tuned in the community tab, and also make sure to follow me on Instagram, because I'm highly active on Instagram. If you've got any questions, you can DM me on Instagram. I would like to answer your questions there as well. Okay, so मिस्टर उमार भाई इज देयर, हाय मैम, कि हम उस मूवमेंट जो रॉन्ग मूवमेंट होती है उसको कंट्रोल कर सके, और उसको कंट्रोल करने के लिए हम इनिबिशन टेक्निक को यूज करते हैं, यानी कि जो मसल्स अननेसेसरीली फायर हो रहे हैं उसको रिलैक्स करते हैं। इसलिए आप एक्सरसाइज कर रहे हो उसके पहले फोकस करो कि आप फेशियल मसाज करें, फेशियल स्ट्रेचिंग करें, और साथ ही साथ जो भी आपको लग रही है जहाँ पे सिनकाइनेसिस की वजह से गलत मूवमेंट हो रही है, उसको आप हाथों की मदद से रोक के जो नॉर्मल मूवमेंट है ये करने की कोशिश करो। ये एक मेथड है जिससे सिनकाइनेसिस प्रिवेंट किया जा सकता है। जैसे कि मैंने एक सर्जरी पे वीडियो बनाया था, एक इंटरव्यू लिया था डॉक्टर्स के साथ, उसमें मैंने बताया था कि सर्जरी इज पॉसिबल जहाँ पे अगर ये उनके लिए है जिनकी फेशियल नर्व में कोई रिकवरी नहीं आती, तो वो जो कंप्रेशन जो फेशियल नर्व पे आ रहा है उसको कम करने की कोशिश की जाती है। बहुत सिवियर केसेस में वो सर्जरी का यूज़ किया जाता है। और कई बार डर्मेटोलॉजिस्ट बोटॉक्स थेरेपी का भी यूज़ करते हैं इन ऑर्डर टू रिलैक्स द ओवर फायरिंग ऑफ मसल, लेकिन ये तभी किया जाता है जब पेशेंट्स की हेल्थ ठीक है। दूसरा, सिनकाइनेसिस बहुत ज़्यादा लेवल पे है और कुछ भी काम नहीं कर रहा है ऐसे दौरान, राइट? तो इसलिए अगर आपको ये सारी ट्रीटमेंट ऑप्शंस कंसिडर करनी है तो ज़रूर से एक डर्मेटोलॉजिस्ट और एक ईएनटी सर्जन को कंसल्ट करिए। ओके, राज इज आस्किंग, बेल्स पल्सी हुआ है, अभी 3rd मंथ चालू है, 1 मंथ थेरेपी ले रहा था, अभी तक ठीक नहीं हुआ। राज, डिपेंड्स, ठीक नहीं होना का डेफिनेशन डिपेंड करता है। कई लोगों को जल्दी रिकवरी आता है, कई लोगों को लेट रिकवरी आता है, कई लोगों को पार्शियल रिकवरी आता है, कई लोगों को कंप्लीट रिकवरी आ जाता है, राइट? इट ऑल डिपेंड्स ऑन योर फेशियल नर्व का कंप्रेशन कितना लेवल का ठीक हुआ है। आप आपके साइड से ये कर सकते हो, आप एक्सरसाइज रेगुलर कर सकते हो, आप आपके फेशियल मसल्स को ठीक रख सकते हो, हॉट कंप्रेशन दे सकते हो फेस को, मसाज कर सकते हो फेस को, और सिनकाइनेसिस को होने से प्रिवेंट कर सकते हो। जैसे-जैसे आपके ईयर पे कंप्रेशन पड़ना कम हो जाएगा, धीरे-धीरे रिकवरी आनी शुरू हो जाएगी। I hope that answer. How to know which grade Bell's palsy? Ma'am, is it very serious matter? Brijesh, it's not a serious matter. It's just that there is a temporary swelling that is compressing your facial nerve and it's causing a paralytic symptom. right? And as the days pass by, you will start moving from one stage to another stage. Unfortunately, few people are left with some synkinesis deficit, but most of the people are out of Bell's palsy within the 3 months of time frame. So it's not a serious problem. And the people who are having synkinesis, they are taught to learn to focus on the muscle inhibition techniques, which means muscle relaxation technique, reducing the overactivity of the muscles, and that's how it is managed. Jaguar, what's your question, ma'am? Do you know what is the actual cause of Bell's palsy? I answer. So, is that any food specifically I have to avoid while I'm in Bell's palsy? Fruits, vegetables, food which I have to avoid. So, as I mentioned, I've made one video already on that. Jaguar, you can watch it again. See, there's no specific food as such that you have to avoid in Bell's palsy. The only thing is the food that increases the inflammation. So which is higher in cholesterol, like fried food, junk food. You have to avoid that. Food that is too hard to chew, since you are having facial muscle weakness, chewing would be a difficulty thing. Thing of difficulty that you have to avoid. You have to also avoid food that is cold in nature, which can increase the cold symptoms like curd, banana, if you're living in a cold weather. So those kind of foods you have to avoid, and a food that contains arginine like walnut is a food that you have to avoid, but otherwise mostly all the foods is something that you can eat. I hope that answers. अभी सब जगह कंप्रेशन दिख रही है बट रिकवरी बहुत स्लो है। राज, आपका टाइम मेरे ख्याल से 3rd मंथ चालू है, ओके, 1 मंथ से थेरेपी है। अगर स्लो है इट्स ओके, बट रिकवरी हो रही है, दैट्स अ गुड पार्ट। सो बी पेशेंट और डोंट फोर्स योरसेल्फ। जितना आप ज्यादा फोर्स करोगे ना फेशियल मसल्स पे, इट हैज एन इमोशनल इम्पैक्ट एज वेल। वो इमोशनल इम्पैक्ट की वजह से भी आपको फेस में रिकवरी नहीं आ रही हो ऐसा लगेगा। इसलिए मेक श्योर टू बी वेरी पेशेंट, फोकस ऑन द पॉजिटिविटी, फोकस ऑन द positive side. See, you are lucky that you have got Bell's palsy, which is recoverable. There are many people who are having facial paralysis due to brain injury, brain surgery, stroke. ऐसे सिचुएशन में डैमेज जो होता है ना वो ब्रेन पे होता है, इट्स इन ब्रेन। सो you cannot do much about brain, and the recovery is very slow, and many people do not recover. At least in Bell's palsy, it's an peripheral region, there are much more chances of recovery. So make sure to be very positive and optimistic towards it. So cold related foods to be avoided, right? Yes, Jaguar, cold related foods has to be avoided. Raj, okay, thanks, ma'am. Hopefully, Raj, please be patient, be strong, you'll be fine for sure. Yes, guys. So I think I'm answering. Okay, so Mohammed is there. What is synkinesis again? So Mohammed, I have also already explained this. What is synkinesis? I'll just let you know again. Just a moment. There are people who are joining on Instagram. So just letting people know that we are doing live sessions. I'll just make an Instagram story. Uh, yes, so this is. I'll just post some email. Any people from Instagram want to join, they can join in. Yeah, so what is synkinesis? So synkinesis is nothing but an miswiring that happens on the coast. So this is an example of synkinesis. I hope this answers your question. Okay. So, is facial paralysis always 100% recoverable? Vivek, unfortunately, there is no disease or else an health problem in this world that exists, which anybody or any doctor can say 100% it will recover. Everybody, every human body is different. So, everybody has different level of chances of recovery. But 75% of cases with Bell's palsy recovers within 3 months. That's a good number. So keep that in mind. ब्रजेश इज आस्किंग कितने बार एक्सरसाइज करना चाहिए एक दिन में? हाँ जी, बिल्कुल 3 से 4 बार एक्सरसाइज करना अच्छा है। हर एक सेट 5-5 बार करें, मतलब हर एक एक्सरसाइज को 5 रिपीटेशन में करें। अगर आपको लगता है कि आप 5 आपके लिए ईज़ी है, लाइक आप काफ़ी दिनों से कर रहे हो, आप यूज़्ड टू हो गए हो, तो आप उसको 10 रिपिटेशंस में कैरी फॉरवर्ड कर सकते हो। लेकिन 3 to 4 टाइम इज़ अ गुड नंबर ऑफ टाइम टू डू द फेशियल एक्सरसाइज। राज आपका इंस्टाग्राम आईडी बताओ। या मेरा इंस्टाग्राम आईडी है physio_मेघना_dave। That's I'll just type in my Instagram ID, physio underscore meghna underscore dave। ओके, सो ये मेरा इंस्टाग्राम आईडी है, आप मुझे उस पे फॉलो कर सकते हो। मैंने एक हेल्थ क्यू का भी इंस्टाग्राम आईडी बनाया हुआ है। ये भी, इसमें भी मैं लाइव रहती हूँ, सो यू कैन पोस्ट ऑन दैट एज वेल। Ramesh is asking, ma'am, please tell me exercises of Bell's palsy. My left side of face fully damaged. I please requested you. Ramesh, I have made a complete video on 21 exercises for Bell's palsy. It's the best way I can demonstrate you all the exercises. You can play and pause those videos whenever you are doing that exercise. You can sit in front of mirror. So I'm having a mirror nearby me. So you can sit in front of mirror, keep your phone next to it, play, do the exercise. Whenever you feel you are not knowing, pause it. That is the best way you can do this exercise. So I hope that video helps you. Jaguar, Ramesh is saying, ma'am, already posted video for Bell's palsy. You check that. Okay. Yogesh is asking, hello, ma'am. It's been 9 years of Bell's palsy now. I'm suffering from synkinesis. My right side of face is affected. Should I need to consult a physiotherapist or a neurologist? Definitely, you need to consult a neurologist to understand what extent of nerve damage has happened and what is the possibility of recovery with the help of surgery or else any other alternative treatment, because it's been a long stretch of time. When it comes to physiotherapist will help you in stretching your facial muscles and also help you in teaching some of the relaxation and inhibition technique of the face that will help you out in reducing the facial palsy. Okay, Ramesh, you have already tried. Yeah, so Ramisha, that's the exercises that you need to do. There's no other exercises that I can tell you right now. It's almost a comprehensive guide that I've made. Please continue doing that exercises, and you're free to stop some exercises which you feel is not helpful to your physiotherapist. Ask which one I should do and which one I should not do. That is much more better way. 3 साल हो चुके हैं मैम, कोर्स कंप्लीट कर चुके हूँ, बट okay, Ramisha, then you need to see an ENT surgeon or else a neurologist to figure out कि कहाँ पे nerve compression है, इसके लिए आगे क्या किया जा सकता है. That's the best thing that I can tell you for this. I hope this answers your question. Okay guys, so 4:18 हुआ है. We have some more time left, around 10 minutes. Hello, ma'am. Namaskar. I am from Nepal. My son has cerebral palsy. My son is 15-month old, cannot sit and also bends backward too much. I'm very depressed. Please give me best advice. So, Mr. Mipang, the best advice that I can give you if your son is having cerebral palsy is to take them to a physiotherapy center, learn some of the developmental exercises that focuses on trunk control. Unfortunately, when it comes to cerebral palsy, every child is different and they need a lot of customization. It's not just like one set of exercise fits for all. That's just not possible. That's why it's better that you take to a physiotherapist, learn which all muscles needs to be worked on, and then focus on improving the strength and flexibility of your child. That's the best thing that you can do. Mohammed is asking, ma'am, what is the importance muscle stimulator in Bell's palsy? So the muscle stimulator in Bell's palsy is just meant to remind the muscle the right movement. What happens when there is initial Bell's palsy? There is paralysis of the face, right? This all muscles are not moving, so they tend to forget the movement because the nerve, the brain sending the message via nerve to the face that you have to move in this way goes away. So, with the help of electrical stimulation, the muscles is constantly reminded of the right movement technique. Second thing, it also helps in preventing the muscle wasting. So, whenever we are not moving a muscle for a long period of time, they tend to get shrinked. Okay, and that is called as muscle wasting, which is an increase in the weakness. So, in order to prevent muscle weakness, in order to prevent muscle wasting, and in order to make sure that the muscles re educate themselves in the right movement pattern, that for that reason electrical muscle stimulation is used, and that is the only reason when your muscles start contracting, the electrical muscle stimulations has to be stopped. Okay, so that's the answer. ज़ैनब मुझे कुछ टिप्स बता दे प्लीज़। टिप्स किस बारे में मैं बताऊँ? बी स्पेसिफिक रमीशा, बिकॉज़ टिप्स बहुत सारी हो सकती है, राइट? इफ यू बी वेरी स्पेसिफिक इन टर्म्स ऑफ व्हाट यू वांट टू नो, देन आई कैन टेल यू। ओके, कानुश्रिया उमर भाई आस्किंग, मैम 20 मंथ्स हो चुके हैं और मेरे एक्सपेक्टेशन भी छोड़ दी है, अभी फिर स्टार्ट करूँ जैसे आपने बताया, कितना टाइम लगेगा रिकवरी में? अनुसुईया, ये बहुत डिफ़िकल्ट है बताना कि कितना टाइम लगेगा रिकवरी में। मैं एक चीज़ जानती हूँ, हमारे हाथ में रिज़ल्ट नहीं होता, हमारे हाथ में कोशिश होती है। तो कोशिश जितना हम करेंगे, हम हमारे बॉडी के बारे में सीखेंगे उतना, राइट? और जितना आप खुद आपकी बॉडी के बारे में सीखोगे, उतना आप बेटर होते जाओगे। जिस दिन आपने कोशिश करनी छोड़ दी, उस दिन रिकवरी भी बंद हो जाएगी। सो प्लीज़ कंटिन्यू डूइंग सम exercises. Don't stop it. Ma'am, and my son fits haven't been controlled yet. Can some type of seizure cannot be cured or controlled? Seizures mostly cannot be cured in terms of, but it can be controlled, which means kids might have on and off episodes of seizure. That's why anti-epileptic medicines are used, and that helps in controlling a seizure to an extent. Massage has got to an extent some level of muscle relaxation that helps. I won't say it totally stops the seizures, but it helps in reducing the overall overactivity of the muscles, and that helps in reducing the seizures also. So you can go for a gentle massaging technique for your child. Hope that answers the question. Yes, anything else, guys, you would like to ask me? We have got, it's 4:23, 5 more minutes. इट्स मीन जो आपने 21 एक्सरसाइज बताई है वो अगेन शुरू कर दो। यस, बिल्कुल रमीशा, आप शुरू रखिए एक्सरसाइज को। यू हैव, आई एम गिविंग यू दिस फुल फ्रीडम रमीशा। आपको ऐसा लगता है कि कोई पार्ट फेस का जहाँ पे वीकनेस ज़्यादा है, उस साइड की एक्सरसाइज ज़्यादा करो। जो फेस का पार्ट आपका ठीक लग रहा है, उसमें आप एक्सरसाइज कम करो। यू कैन डू इट, राइट? इट्स नॉट दैट, जस्ट ओवरडू मत करो। ऐसा नहीं होना चाहिए कि आपके मसल्स थक गए, है ना? मसल्स थकने नहीं चाहिए, उनमें स्फूर्ति लानी है आपको। इसलिए बहुत ही ग्रेजुअल पेस में आप एक्सरसाइज को करते रहो। Arav Deshmukh, I hope this exercise will cure her. Hopefully, yes. See, I feel cure is a very broad term. Maximum of diseases, trust me, guys, are not completely curable, but that doesn't mean that it will not go. People live with it, right? But live in a very better way. It's all about the maintenance. Please understand this point, what I'm trying to say. It's okay to live with a problem, but it's not okay to suffer with that problem, right? What you need to do is to deal with the problem in a way that you don't suffer from it. Okay, and for that you need to take some measures or steps that helps you in order to deal with the problem. That's what is my message that I would like to tell. I'll give a simple example. I am a patient of allergic rhinitis. Okay, allergic rhinitis एक ऐसी problem है जो common cold जिसको कहा जाता है. Now allergic rhinitis is a not a curable problem. Got it, guys? मतलब जिसको एक बार एक चीज की एलर्जी लग गई, उसको बार बार उसकी एलर्जी होने वाली है, और उसके वजह से बार बार आपको सर्दी होना, छींक आना, ये सिम्टम्स आते रहते हैं. दैट डजंट मीन आई विल नेवर बी क्योर्ड, right? Because it's not a curable problem, but still I am dealing with it in a way that I'm not suffering from it, right? सेम वे बेल्स पाल्सी का भी कई लोगों के साथ ऐसा हो सकता है. इट्स नॉट नेसेसरी कि वो पूरा नहीं गया तो आप नहीं रह पाओगे. यू कैन डील विद इट. देयर इज ऑलवेज एन बेटर वे एंड यू हैव टू वर्क टुवर्ड्स इट. Okay, Ramisha, thank you so much for sharing your love. Mipang asking, ma'am, what is the treatment of spasticity? My son bends backward too much with great force. Will therapy definitely helps? 1 minute, guys. Therapy definitely helps, and you should continue taking therapy. I'm suffering from Bell's palsy from 4 days. Abhinav, please continue doing the exercises. Do not stop it. Three months of time you should definitely give for the therapy so that it will help you out.